welcome to Pharma Digital, and here in this video I am gonna discuss about the some important question which are arises from the topic blood. So first question is, what is blood? Blood is a red color fluid connective tissue and it has a pH of about 7.4 and it contain different blood cells and watery fluids, and that is known as blood. And this blood is flow through different blood vessels. And next question is, what is a name of its component? Basically blood consists of two components. One is blood plasma, that is about 55%, and another is blood cell that is about 45% of the total blood. Next is full form of WBC and RBC. Means WBC stands for white blood cell or white blood corpuscles, like that RBC stands for red blood cell or red blood corpuscles. What is phagocytosis? Phagocytosis is a defense mechanism of our body, and most of the WBC cell are responsible for this phagocytosis actions. Means when we in contact with different pathogens and when we engulf any types of pathogens that create disease, our body started engulf that materials and try to destroy it, and this mechanism is called as phagocytosis. And which blood cell play first line defense mechanism? As we know, most of the WBC cell are play first line defense. WBC cell are produce phagocytosis action and defense mechanism, but neutrophils is considered as a first line defense mechanism cell, and whereas monocyte it considered as a second line defense mechanism cell. Then what is ESR? ESR stands for erythrocyte sedimentation rate, and it is the natural settle down of the RBC in a test tube containing blood sample, and its unit is or its result is measured in millimeter per hour. Means how millimeter of red blood cell is settle down at the bottom of the test tube per hour, and this ESR is higher in female than the male, and it is differed according to the age. Next is, what is erythropoiesis? Erythropoiesis means it is the process of formation of the erythrocyte. As you know, bone marrow producing different types of blood cells. So how the bone marrow produce erythrocyte? That is known as erythropoiesis. What is blood clotting? Means it is a complex or clump created by the platelets to prevent the blood bleeding. What is anemia and what are the types of anemia? As you know, anemia is a disorder where RBC number is decreased, and there are four types of anemia present. One is hemolytic anemia, another is aplastic anemia, and megaloblastic anemia, and also known as iron deficiency anemia. In iron deficiency anemia, hemoglobin concentration decrease in red blood cell. In aplastic anemia, bone marrow depressed, that's why RBC is not properly formation occurs. And in megaloblast there is a large size, and here in 12 number question, what is megaloblast? Due to deficiency of folic acid and vitamin B12, large size RBC is formed, and that is called as megaloblast. What happens when large size RBC is formed? This obstruct the blood flow in blood vessels. Next is, what is and who is invented the circulatory system? That is William Harvey. Next, blood group is invented by whom? Blood group is invented by the Karl Landsteiner, but AB blood group is invented by the De Castillo and Starley. Means Karl Landsteiner invent the B blood group, A blood group, and O blood group. Next is, what is cross matching? Cross matching means it is a when we take sample of the donor and blood donor and blood acceptor, and agglutination occurs or not is observed in a test tube. Means some sample of the blood donor and some sample of the blood acceptor is collected in a test tube and observe when agglutination occurs or not. If agglutination occurs, there is no blood transfusing process is done between this acceptor and blood donor. Next is what is ISBT. It is a barcode prescribed in blood package, and it is stands for ISBT stand for International Society of Blood Transfusion. Next is what is leukopoiesis. Leukopoiesis means it is the formation of the process of formation of the leukocyte, that is leukopoiesis. In erythrocyte, that is called as erythropoiesis. What is blood transfusion? Means transformation of the blood from one donor to one acceptor in case of emergency or needed, that is the blood transfusion process. What is the synonym of RBC, WBC and platelet? Synonym of RBC is erythrocyte, and WBC is leukocyte, and platelets is thrombocyte. And next question is what is thrombocytosis? As we know, cytosis suffix indicates the increase in number and penia suffix is decrease in number. Here the thrombocytosis means increase in number of thrombocyte. As we know, thrombocyte is the synonym of platelets, means here increase in number of platelets. One is hemophilia. Hemophilia is a genetic disorder where due to deficiency of factor 8, that is also known as anti-hemophilic factor, blood clotting is naturally doesn't occur, that is known as hemophilia. What is the rate of hemoglobin? Means how much hemoglobin is contained in RBC. As we know, RBC is approx 63% of water and 35% of the hemoglobin. Remaining containing is enzymes and proteins. So here the rate of hemoglobin is 35% in RBC. Blood consists of how much ml per body weight? Here the answer is 80 ml per kg. And according to percentage, 8% of the total body weight. Next is blood is a which type of tissue? As we know, blood is a connective tissue and it is a fluid in state, that is called as fluid connective tissue. What is anti-hemophilic factor? Factor 8 is called as anti-hemophilic factor, and due to this deficiency, hemophilia diseases occur where naturally blood clotting processes doesn't occur. Mechanism of blood clotting. It is a mechanism where clotting means clumping of the blood cells occurs, and to prevent the blood bleeding. And how this happens? By the help of different clotting factors. It is called as blood clotting mechanism. Bleeding time means when we got injured, how many times our blood start bleeding? Means it is a time of 2 to 5 minutes or 2 to 8 minutes. Approximately it is considered as a 2 to 5 minutes. What is leukopenia? As the suffix indicate, penia means decrease in number and leuco means a term is derived from the leukocyte, means decrease in number is called as leukopenia. Next, what is leukemia? It is a cancerous condition where excessive increase of the leukocyte means more than 50,000 per cubic millimeter and production of the abnormal WBC or leukocyte, and that condition is called as leukemia. What is TLC? TLC stand for total leukocyte, means what are the numbers of total leukocyte cell present in our circulation. That test is performed and that is known as total leukocyte count. And next is what is DC? Differential leukocyte count, means WBC and DC or DLC, it is also known as DLC, means differential leukocyte count. Here how much number of eosinophil is present, how much number of neutrophil is present, how much number of monocyte is present, all the different leukocyte number or percentages count in our blood circulatory system. Next, what is purpura? Purpura means it is the internal clotting on the mucous membrane, skin occurs, and that is the purpura, because it create purple patches or purple patches of clotting in mucous membrane and skin. Next, what is the plasma protein? As we know, plasma protein, albumin, globulin, fibrinogen, alpha glycoprotein. There are different types of plasma proteins are present. Next, what is the composition of the RBC? RBC composed of approx 63% of water, 35% of hemoglobin, and remaining some contains about some enzyme proteins about 1 to 2%. Next is, what is plasma? It is a colorless part of the blood, and it is almost about 55% of the total blood. Next is, what are the types of granulocyte? There are 3 types of granulocyte, and first WBC divided into 2 categories. One is granulocyte and another is agranulocyte. In granulocyte there is 3 cell: neutrophil, basophil, and eosinophil. And in agranulocyte there is 2 cell, that is monocyte and lymphocyte. Next is, what is the function of the RBC? RBC helps for the maintenance of acid and base of our body system. It also helps for the exhale or remove out carbon dioxide from the body and supply of oxygen from the lungs to different body tissue. Now, what is the function of WBC? As we know, WBC is WBC provide main function is to protect defense mechanism of our body, and that is phagocytosis action. And it is also their WBC cell also contain heparin, that is also called a natural anticoagulant, means it helps to maintain the fluid state during flowing of blood or maintain the fluidity of the blood. And another chemicals, that is histamine, are also present in WBC. Histamine, that is released during when we got any types of allergen enter to our body, and that allergens reaction is diminished by the histamine. Next, what is the function of the platelets? The main function of the platelets to regulate the blood clotting. Next, what is the amount of blood volume? That is about 6 to 7 liters of the blood in a healthy individual. Which blood group have higher frequency of India? That is the O positive or B positive. Which blood group have lower frequency in India? That is AB negative. That is about almost 2% of the total frequency. What is name of the universal blood donor group? That is O negative, and universal recipient group, that is AB positive. And next question is, what is hemolytic anemia? It is a type of anemia. Anemia means decrease in number of RBC. Here hemolytic anemia means, as you know, WBC have a lifespan of 12 to 14 days, and RBC have a lifespan of 120 days, and after that RBC is destroyed in our body or inactivate in our body and excrete out through the urine and stool. So here excessive breakdown of the normal RBC are also occurs due to different disorder like dengue, malaria, and also due to deficient in different nutrients that are required for the formation of the matured RBC. And here hemolytic anemia means hem plus lysis, means lysis means breakdown, means excessive breakdown of the red blood cell or hemoglobin, that is known as hemolytic anemia. Next is, one ferrous contain how many oxygen molecules? Here one ferrous contain 1 molecules of oxygen. As we know, one hemoglobin consists of 4 molecules of ferrous, means one hemoglobin carry 4 molecules of oxygen also. So this is all about all the questions which are arises from the topic blood. If you have any kind of doubt, frequently register your comment in comment box. Have a good day.